Who should avoid it? That's a good question. You know, there's sort of a myth in the helping profession that everybody goes into it because they have their own personal problems. And that's probably who should avoid it. People that have severe personal problems that have not worked through them and have not resolved them. Because it's not a good place to resolve your own personal problems. A good therapist is completely there for their client. And if their problems are getting triggered off, let's say you have a drinking problem, which I know you don't, and I have a drinking problem, I'm not going to be very helpful to you. So
it's going to push your buttons.
Yeah, and so I think, you know, that myth is actually the opposite of what's really true, that it's better if people have worked through their issues and feel pretty healthy psychologically.
Well, I remember when I first heard, and it surprised me, that therapists have their own therapists, but it makes sense to keep your issues out of the therapy. You need to keep rebalancing and not let people push your points or your trigger points, right?
Exactly, exactly. And that's why most therapists will from time to time consult with a therapist to help resolve any issues that might be coming up.
And I would think, you mentioned patience as one of the skills. I would think that would have to be a huge one, because don't you have the temptation to want to jump in and solve it and put more into it? I feel almost like an urgency to say, I can fix that, I can, and you can't. You have to let it unfold, right? That's part of the patience.
Right, and also it's, you know, the purpose of good psychotherapy is to empower the client in order to grow, not to grow for them. So the patience issue is important, and also not being so invested in fixing them. Being a consultant and helping them to fix their own problems is much more effective than trying to fix their problems. And that's, you know, a lot of people with good intentions end up being not so good therapists because they're so intent on fixing everybody's problems.
Okay, I can relate to that from the coaching perspective as well.
It's a similar issue for coaching.
What I'd like to ask you, what are the biggest challenges you find in being a psychotherapist, and also the biggest rewards that you want to get up in the morning and do it, or you're looking forward to it, and also the things that you know.
Yeah,
so
the
challenges and rewards.
Okay, let me talk about the rewards first.
Okay.
The thing I love best about doing what I do is that I really get to see people change and grow. And so, for instance, I had a patient who had been housebound with agoraphobia, which is a very severe phobia, for 20 years. She hadn't left her house other than to maybe go 1 block away. And I worked with her first a few sessions at her home, and then in my office, 10 or 15 sessions. And now I get postcards from her from all over the world where she'll send me a postcard and she'll mark a tiny little X like on the top of a mountain and say, "This is me." You know, and she loves to travel, and she's retired, and she travels all over the world now. So
what a
just
wonderful feeling that you contributed to that.
Yeah, and you know, I always get postcards saying thank you for freeing me from my house.
Oh
you know?
my gosh, that's wonderful.
So that's the rewarding part of what I do. You asked me the challenging part.
Yeah, the part where you have to really stay the course and get through.
Yeah, I think there are 2 big challenges. The first is really that there are times when I'm really responsible in some ways for life and death. I mean, I work with depressed people, sometimes they're suicidal, and that can be pretty heavy and pretty scary at times. You know, that's, I think, one of the challenging parts of the mental health field. Another aspect that's challenging is actually, it's a little bit like working in the CIA counter-terrorist unit, in that because of privacy and confidentiality issues, I can't really talk much about what I do. You know, I can talk in general terms, but not in specifics. So,
are you allowed to consult? You talk about consulting with other psychologists. Can you have somebody look at the case and help you?
Yes, professionals sometimes collaborate together and discuss anonymously cases and work on them, you know, and I tell my patients that I will probably do that. But in terms of, you know, let's say you've done something wonderful that day, you can't, you know, call up all your friends and say, wow, I'm a great therapist, look at what I did. You can't do that. So it's a little bit like, you know, stopping terrorism, you know, the CIA people who do that don't brag about it.
Oh, okay, okay. Another question I had for you is about some of the trends in the field. If there's something that you think is going on that new people to the field will be excited about, or that you're excited about.
Well, I think for me the most exciting trend in the field or new development has been the development of cognitive behavioral therapy techniques. These are probably the most recent major branch of psychology, and what's really exciting about them is that they were developed by research scientists to treat specific problems, and the treatments were custom designed for the problems. So rather than applying the same treatment for all problems, there are specific treatments for specific problems. And some of these treatments are remarkably effective. For instance, cognitive behavioral treatment of panic disorder or panic attacks has about an 85 to 90% cure rate at the end of maybe 12 or 14 sessions of therapy.
Wow, that's impressive.
Yeah, so it's really exciting. We have similar treatments for obsessive compulsive disorder, similar treatments that take a little bit longer for depression. There's a wide range of specialized treatments that are being developed now, which really let people get benefit right away rather than spending years talking about their childhood laying on a couch. And
Is this a movement of the last 20 years, or how far back does it go?
it's the last 20 years, but some of the most exciting work has really been done in the last 10 or so years, where people have taken the general approach and then developed very specific treatments for specific problems.
Well, that is exciting.
Yeah,
I
so
can
I'm
see
excited.
why you practice it.
Yeah, I love it because I love seeing results.
What I thought we would talk about is tips to build practices, and I
Okay.
think we're going to have a graphic for this, but I think this is a really useful topic, not only for the people out there who are beginning to build a practice, but for anybody that's being entrepreneurial and trying to market and bring clients to themselves, because these are basic marketing principles. And I know that you've been really successful in having a full practice, so you must have employed at least some of these methods. So can we go through? I have my cheat sheet here.
Okay.
So you talk about talking to everyone you know in an enthusiastic way, like a 10-second pitch.
Yeah, I think it's very important to just let people know what you do. And you should have a very brief explanation. And for instance, I might say something like, I'm a psychologist in private practice who helps people solve problems using short-term cognitive behavioral therapy. Or, you know, I don't spend years talking about people's childhood. I just focus in on the problem and help them to solve it. Nice, short, simple tagline. And that could be something that any professional could.
Yeah.
I'm a stockbroker who specializes in energy stocks.
Okay. And then you talked about, you give talks on problems you like to treat. So maybe that's at a conference or a professional association or wherever?
Yeah, wherever really, wherever you're invited to talk, or you can give public talks. The idea here, and of several of the other marketing ideas that I utilize, is to really become an expert in an area and then get that out to the world that you have that knowledge. So for instance, when you give talks, it's especially useful if you give talks to potential referrers. So people like doctors or lawyers, the people who refer clients as opposed to customers.
Also, when they hear about a problem, panic disorder, they say Andrew Gottlieb.
Right, and one good referrer, like one physician, can refer hundreds of patients. So it's much more powerful than trying to reach the clients directly. So that's one of the things that sometimes people make a mistake about, which is they give wonderful public talks and maybe they get one client out of it.
Yeah, I'm jumping out of order here, but you also say let your clients know you take referrals.
Yeah,
so
just
that's part of it. Again, word of mouth, right?
Exactly, because sometimes a lot of people will assume if you're busy that you're full. You know, they will assume you don't have room for new patients. I get calls all the time. Do you have any room for a new patient? And, you know, I say, of course I have room for a new patient. I'll make room for a new patient.